It's time for Dr. Kevin Kavanagh. He is a retired ENT physician from Somerset, Kentucky. Started an organization called Health Watch USA. Dr. Kavanagh, good morning, sir.
Good morning, Jack.
I think he's always great at putting notes together for me, but I think since you did that, scientists in the United Kingdom have come up with what they're calling a major breakthrough as trials. They found a cheap common steroid that seems to be reducing the death rates of people with severe COVID-19 cases by about 1/3. What can you tell us about Dexamethasone?
Oh, dexamethasone, yes. Well, this came out of the recovery trial, which is a large trial out of Oxford in England. They're looking at a number of different treatments. And what they found is that if dexamethasone is given to patients who are on respiratory support, in other words, getting oxygen or they're on a ventilator, their death rate can fall up to 1/3. And this is huge. This is a low-dose steroid that was given, 6 milligrams once a day, and it is a commonly used steroid. It's very inexpensive. It would be one of these probably $1-a-month prescriptions that you would get at Myers, or a free drug on certain drug plans. I mean, it is extremely inexpensive, well-known, and has been used a lot. This underscores one of the points and dangers of this virus is that when you get extremely sick, what happens is your body gears up too much to fight the virus, so that you have your own immune system actually starts working against you. This treatment will tend to quiet that down and allow patients to recover more naturally. And it is a breakthrough. It is very good. But I must add, I don't intend to get to the point where I get very sick or need oxygen from this virus. We still need strategies to prevent us from getting there. So don't think that, oh, they found a cure, we don't need to wear masks, we don't need a social distance. That's not the case. These patients are still very sick.
They say this has not been peer-reviewed, but they're going to maybe fast-track it because it could be saving a bunch of lives.
Yes, and this is out of Oxford. It's a prospective randomized controlled study. Very good research group. Now, just a few days ago, they also released their data on hydroxychloroquine, and that was negative. So that's now another study. We're up to 8 studies now that have shown no benefit. Of course, there was another study that was negative that was withdrawn, but 8 studies that are not withdrawn, no benefit. To my knowledge, there is no study that shows hydroxychloroquine will help. And on the basis of this research, the FDA has now withdrawn their recommendations for even using hydroxychloroquine on an emergency basis.
Wow. What about that product that they're testing in Europe?
Well, and that is another drug which is looking like it will treat patients with COVID-19, and that will even treat early patients. That's what it's designed for. It is monoclonal antibodies. These are the antibodies that are made in a lab, but they're the best antibodies and the strongest antibodies that they can identify. A lot of them, and they're injected into the patient, given as an infusion or IV. And this is what my understanding is. This is designed for patients that are just coming on with the disease, that it may be able to avert any sort of severe symptoms coming along, and we will have to wait and see for the final tests. Right now, it is in phase 3 of the trials, which is looking at its efficacy. In other words, will it work as intended? It has completed safety protocols and tests, which are the prior phases, and they are hoping to have this treatment available by the end of September.
Big rally coming up this weekend for the president in Tulsa, and the CDC is warning on viral spreading at rallies.
Yes, this is not a good idea. This is akin to holding a church service and singing without masks. It's just not a good idea. It has a potential of being a super spreader event. It is indoors. People are shouting. They'll be packed together. And to me, that's very scary. We still need to treat this virus seriously. We can open up our economy and we can have a viable nation, but we can't do that if we're not being safe. And so we have to follow good public health practices. For me, I am very worried about this type of an activity and agree with the CDC along with the public health officials in Oklahoma.
And then finally, there was a review of 16 studies that concluded asymptomatic spread has a rate of approximately 40 to 45%.
That's correct. This was a study in the Annals of Internal Medicine. They looked at 16 cohorts, which are groups of patients that were studied in 16 different studies, and they did come up with a figure of 45% of the cases can get asymptomatic spread from someone who they just didn't even realize had the infection. And that's the reason why it is so important to wear a mask. There was another study, I believe, in the New England Journal of Medicine that showed that most people who are asymptomatic in spreading the virus stay that way up until the time, which I believe takes usually just a few weeks, where their body will cure the virus and get rid of it. So asymptomatic spread is real. You may not know that you have it. It may occur much more frequently in younger people than older, and that is why everyone needs to wear a mask. And as I said before, there are some modeling studies which indicate that wearing a mask and social distancing alone can stop this pandemic. So let's all do that. Let's be safe and make a strong America and a strong economy.
Dr. Kevin Kavanagh, thank you very much, sir. We shall talk to you in a couple of days.
All right. Thank you, sir. Bye.